few weeks now, allergies have been hitting people really hard, and Jen Tolm is here with how to relieve the itchy nose and the eyes. I know I have allergies and it stinks. So.
Yeah, sometimes it's just not fun being outside, even though we all want to be outside. And with the warmer temperatures and blossoming trees and flowers, the pollen in the air wreaks havoc on our senses. In today's House Calls, Dr. Michelle Conroy, attending allergist and clinical immunologist in the pulmonary department at UMass Memorial Medical Center, joins us live via Skype. Thank you for joining us, Doctor.
Hi, Jen. Thank you.
Well, a lot of people are suffering from allergies. What's in the air now that's causing their problems?
So, as you mentioned, people have been seeing a lot of pollen in the air. You just have to look on the windshield of your car to see that layer of yellow that's there. We have been benefited by a really beautiful spring, but the flip side of that is that it's been very dry and very mild, and that allows really the pollen levels to establish themselves and sort of stay saturated in the environment for really long periods of time. So people with allergies are really struggling at this point. There's really not been good reprieve.
Well, how do you know what you're allergic to? Are there tests that can be done?
Yeah, so as allergists, we actually have several tests that we can use. There's skin testing. That the great thing about that is you come for an office visit, in 15 minutes we can tell you what your allergies are. That would include both indoor and outdoor allergies, which sometimes kind of work together to make things even worse. And the whole goal is to really modify people's exposures.
Okay, so I was going to ask what is the reason why it's important to find out which one you're allergic to, because can you just take medicine and it would cure any type of allergy? Sure,
you can, to a certain extent, people can certainly take, there are a lot of over-the-counter medications, but many people suffer from multiple allergies, some of which they may not be aware of, and that would include frequently indoor allergies. For example, dust mites. A lot of people are allergic to dust, basically, and you can imagine if you're allergic to things both indoors and outdoors, those kind of combine to make things even worse. If we're able to identify what it is, then we can help you get away from it and start to feel better.
And you mentioned over-the-counter medications. What if they don't work or they have side effects that people don't like?
Right. No, it's a great question. So if they don't work, again, I would be more curious to see if there are probably multiple allergies that are playing a role in a person's symptoms presently, like someone who has allergies now that perhaps an over-the-counter medication isn't working. They may have an indoor allergy that they need help with. So again, identifying the allergies and modifying the exposure to those is really important in helping to get the person better.
Is there anything else that people can do to reduce their allergy symptoms besides medication and reducing?
Again, the environmental exposures are important. Try to keep yourself from being outdoors at high pollen times. So, basically between the hours of 10 and 2 when it's really warm, that will be sort of the worst time. So doing things to basically decrease the amount of allergen that you're seeing can be very helpful, in addition to the medications that, as you mentioned, sometimes have really side effects that are difficult to tolerate.
Well, thank you, Dr. Conroy, for joining us today. Now, if you have a question about allergies or another medical issue, email us at housecalls@cbs3springfield.com.